try to get everything set up real quick in terms of sharing my screen. Let us see just one moment. Are you guys able to see the screen?
Yes.
Okay. Good morning, everyone. My name is Dr. Edison Manaloto. Thank you for having me. The title of my presentation will be The Science of Reopening, Balancing Public Health and the Economy. Thank you for the introduction, SVP Enriquez. It's always a pleasure to talk to you guys. So a brief outline of the presentation. I want to first give an overview of the coronavirus pandemic, how it started and where we are at, the numerous public health challenges that the United States in particular has encountered during this time, our response to date, and some strategies that were employed in order to contain and mitigate the spread of the virus. I want to focus also on the economic impact of the virus in the United States, as well as the pandemic approach in other countries. As we've seen, there have been various experiences in different countries in terms of successes and failures and what lessons we can learn from each of these experiences. And finally, just going forward and giving a recap, incorporating all these things and what we envision the new normal in Guam to be, as well as the various strategies we could employ. So to give an overview of the coronavirus pandemic, the first case was reported in December 2019 in Wuhan, China. The causative agent is a viral agent. It is a family of respiratory viruses known as coronavirus. This is similar to the various types of viruses that have caused previous outbreaks in Asia primarily. In 2003, there was the SARS outbreak, and most recently, the MERS-CoV outbreak. So this is all in the same family. As you can see from the picture that I posted, the coronavirus got its name for the characteristic spikes that it has, which is a key aspect of its pathogenicity. Now, what do we know about the pathophysiology of this virus? The incubation period is about 14 days, hence why these quarantine measures have been around that period, because people tend to typically show symptoms occurring between 2 up to 24 days actually, although the average has been 14 days. And in most cases, within 5 days of exposure, people affected or infected with the virus will display some form of respiratory symptoms, including cough, fever, or even shortness of breath, which are the triad of the disease. Now, in the United States, according to the Centers of Disease Control, there have been a total of 6.7 million cases as of September 18th and a total death count of 198,000. Now, this is an interesting snippet from the CDC website in terms of the death by age groups, right? As you can see that the coronavirus is not an equal opportunity killer in the sense that it affects and is able to have worse clinical outcomes in people who are older. If you can see here, the great majority, I would say 70% of the people who have poor clinical outcomes from the disease are greater than the age of 65 years old. So this virus is very selective in that it affects people who are in the older age spectrum. Now, in terms of the death by gender, an interesting thing is that on average, the number of people affected in terms of males and females is about equal, but there is a higher mortality rate with males, right? So if you can see here, about 54% of the deaths are accounted for by males, as well as although there are equal number of infected between males and females to account for that difference. Now, this is a study by Chen and Associates in terms of, we hear this a lot in terms of the blurbs or the pronouncements from the JIC in terms of this individual with comorbidities, right? So what are the common comorbidities that can lead to worsen clinical outcomes and progression? Now, this was a meta-analysis by Chen and Associates that compiled various it's a systematic review in which they compiled various studies in terms of what were the characteristics of individuals that would prognosticate a poor outcome. Now, if you can see here, in terms of trying to simplify the data and the statistics themselves, is that if you can see a number that is greater than 1, that implies a higher risk, right? So I would turn your attention to this section where it says multivariable hazard risk ratio, will show you that the biggest risk factor is actually age. It's a non-modifiable risk factor, and that older people greater than 65 years old are at a higher risk for poor clinical outcomes in terms of the virus. Now, in terms of gender, you can see it's here 1.7. In terms of the other common causes, right, of death, people who have underlying hypertension, diabetes, coronary artery disease, and chronic obstructive pulmonary disease. Now, this becomes very important because if we look at the demographics of our island and the amount of people who are affected with these chronic conditions, it is actually, we have a higher than normal average in terms of Pacific Islanders in general have a higher than normal percentage or prevalence of diabetes in our community. So this becomes more relevant in the sense that in terms of how do we plan and how do we mitigate and risk stratify the risk for different people. So one interesting thing of this early study has been that smoking actually might be protective, but there is new research that's showing that this may not be true. So a hazard ratio greater than 1 implies it's associated with a poorer outcome, and anything less than 1 implies something that is protective. Okay. Now, since the virus broke out, we've had this, I would say, not unified response to the virus. It's been very fragmented, and this is owing to the fact that our federal response system, or our system of government, is one in which we speak about this federalism, right? We have this tripartite form of government, this constitutional republic that has its advantages. The systems of checks and balances allows us to basically create policy, but in a way that's much slower than, let's say, for example, a parliamentary form of government or a unitary form of government in which countries like South Korea and other places have. We have one where it's a presidential constitutional republic, in the sense that we have the systems and checks and balances, and we really haven't had a unified response or a strong federal response to the virus. The first case was reported in the United States in January 21, 2020. Now, between February and March of 2020 was a rapid acceleration of the virus. Now, I just want to take this snippet from the CDC's website and what they attributed to be the rapid spread of the virus. Number one, they attributed to continued travel associated importations, meaning we did not close any of our skies. There was continued unrestricted movement between countries and between states. Number two, there was no mass prohibition on large gatherings, right? And stay-at-home orders really did not happen until much later. There was introduction of the virus into high-risk workplace and in densely populated areas. I think we have all seen from the news reports and the media reports in terms of its impact on New York. It's because of the density, it could be attributed to that. And one of the things that's been, a lot of research is going into it now, has been the transmission of the virus between asymptomatic and pre-symptomatic spread. There was considerable debate in terms of whether this virus was actually spread between people who may have been asymptomatic. And the verdict is that about a third of the cases of transmission are related to people who may not have demonstrated any clinical symptoms, meaning these are people that did not have a cough, did not have a fever, or did not have shortness of breath, yet they continue to spread the virus itself. Now, in terms of the challenges in the public sector, what has been the biggest challenge has been this limited testing capacity. The United States has been behind in terms of having the adequate testing capacity on a national, state, and local level. We did not prepare for this virus. We did not have the proper equipment in terms of both testing kits as well as personal protective equipment, which has been a detriment to our death count, really. Not being able to test enough, contain enough, and get a sort of a proper accounting of how much this has spread in the community has been to our detriment. And to also give you guys an idea in terms of hospital capacity is another key thing. The reason why a lot of these stay-at-home orders were implemented is primarily not to overwhelm the hospital capacity. Now, in healthcare, we talk about the standard of care. The standard of care I would best describe it as a routine medical care that could be given in normal circumstances. When you reach the threshold in which you exceed your hospital capacity to be able to absorb that shock from this new coronavirus, you go into what's called an emergency standard of care, emergency level of care, which when you have that happen in a hospital, normal policies and procedures that are in place to prevent and to basically mitigate against mortality and morbidity fail. You don't have those systems, those actual systems in place. Hence, mortality goes up. We have seen that in other countries, primarily Italy, in which their healthcare system was overwhelmed. And to give you guys an idea in terms of how Italy is a resource-rich healthcare community. According to the US World Bank, right, the number of beds per 1,000 individuals in Italy is 3.4. Compare that with the general United States. The United States has on average for every 1,000 people, we have 2.9 beds. And I was just doing some quick math based on our capacity here. Assuming we have a 200 bed capacity between GMH and GRMC per our 100,000 people, our total hospital bed per 1,000 on island is 1.3. So we are grossly below not only just a US standard, but world standards in terms of having the number of hospital beds to be able to accommodate this shock to our healthcare system. Now, what has been the primary strategy in order to contain this virus? There has been this utilization of community lockdowns between March and May 2020. Now, the issue has been there's been various stay-at-home orders. And the CDC has concluded actually in their website is that states that have implemented this stay-at-home order much earlier, as well as the implementation of face mask usage to reduce transmission, have been better able to control and contain this virus. And they cited various states, primarily California, New York, when they started doing this, versus other states that were later in terms of their implementation of stay-at-home orders, as well as universal masks or encouraging widespread mask use. Now, lockdowns work. That is the conclusion. They work to reduce the transmission of the virus because it's actually very simple. They starve the virus of its transmission host. If you limit activity or interactions between people, you limit the spread of virus. But, and this is a huge but, economic lockdowns do not come without an economic cost. The devastation from this COVID-19 pandemic, the early research, right? We don't even have a complete grasp or a complete accounting of how much this virus, these stay-at-home orders have devastated our economy. Now, I was looking at various research in terms of different things. Now, I got this from Chen et al. It's a working paper from the IMF that estimated the coronavirus impact in the United States. It was released in July of this year. And they estimated that, 30 million new unemployment claims have been filed in the first week since the pandemic. That's a lot, right? This is from the Carsey School of Public Policy by Ettlinger and Hensley in terms of what has been the impact on states in the United States. So the School of Public Policy estimated a total of 11.5 million jobs lost because of this virus. And a big proportion of those may not be ever coming back. They may never recover. Now, the Brookings Institute also estimates these 10 different effects of the virus. And I just want to highlight just several of them. Now, small business revenue, which has been the primary economic driver of this country, is down by 20% since January. Chapter 11 bankruptcies have increased this year compared to the same time last year. And an estimated 420,000 of small businesses have failed since the pandemic that may not recover. Now, the effect of this pandemic has not been equal. It has also highlighted the economic and social disparities in our community. The Brookings Institute estimates that low-income families with children were the most likely to experience income shock from the virus, right? Along with this, the rate of food insecurity doubled for households with children versus those without. So if we can see, a lot of data is emerging now in terms of how this virus has affected not just the country, the economics of it, but the fact that the impact has not been equal. This virus has ravaged poorer, predominantly minority communities at a much greater scale than ones that are more affluent. And I think this is a key lesson in that we experience that in Guam. And I think we should also, it behooves us as a community to address these disparities, because these disparities will help us in the long run to be able to better control this virus. Now, what has been the pandemic approach in other countries? We have seen countries like South Korea. You are looking at news reports. New Zealand has opened up. European countries have opened up. Why are we still in lockdown? So primarily, one of the things that people fail to realize is that these countries have had pandemic training, have prepared for this for the past 17 years. When initially the MERS-CoV and the SARS outbreak had occurred in East Asia, these countries were poorly prepared to address this. And they have taken lessons during that time for the past 17 years to prepare for another pandemic. So they've actually had adequate time, and they've been preparing for this. Although we have known about the SARS epidemic, it really did not hit us, but they have actually been ahead of the curve in being able to invest in a testing infrastructure since the time that they've had the SARS outbreak in 2003. They have also learned from the MERS outbreak. So they put a public health infrastructure in place that has been able to confront and able to mitigate and to quickly address the virus itself. Now, another story is one in which, our European neighbors are doing well. And this is from the Exemplars in Global Health. It's this nonprofit organization that is funded by the Gates Foundation. Germany has been able to open up economic activity with little disruption. And how did they do it? Like what I said, part of it is also their system of government. They have allowed a lot of strong local empowerment to be able to contain the virus. So in terms of their regulatory legal infrastructure, it allowed faster response from the local level to be able to deal with this. And I think that's a lesson that we have to learn and prepare for any subsequent pandemics. Now, we have also seen in other countries, they have incorporated technology. I always point to this New Zealand COVID Tracer app because I'm so glad that we now have a coronavirus app. I think it was launched. I think it is a great start. I think there are ways that we can improve it. But one of the things this New Zealand COVID Tracer app has is that it has the ability for the user to be able to, when they enter a business, scan a QR code. So it's able to log in terms of that user was there, so that in the event there's an outbreak or there was a positive case in that area, you can easily trace people. You can easily notify people, send a notification. You may have been exposed to somebody that had tested positive during that time, and make contact tracing more efficient and easier. Okay. So one of the things that I talk about is that this idea of risk stratification. Our coronavirus strategy has to be one that makes sense, because if it doesn't make sense, people are less likely to abide by it, right? We have seen a lot of dissent in our community, dissatisfaction, and I don't think we can just ignore those point blank. They are legitimate concerns. Like what I said, the impact of this virus is great. The economic impact, the full accounting of which is not known. But we have to be systematic in terms of when we make our policies, right? Not every activity that is done is of equal risk, right? So there's even this concept, this is actually from a journal in India, that lists specific activities that are considered super spreaders, meaning me going to the beach by myself will not contribute to the spread of the virus versus me going to a choir practice, me going to work, me going to the grocery store. Those are all different risks. And we have to be able to tailor our policies based on the data that we have. Which are the higher risk activities and what additional precautions can we take? Now, in terms of going forward in Guam, we've had the response, we're on our second lockdown. How do we get out of it is the first question. And the second question is, how do we prevent it from happening again? Isolation facilities. Right now, we have consolidated and have a single isolation facility for quarantining travelers. But that's only one part of the equation. I think the other part of the equation is recognizing that on Guam, similar to Hawaii, you have multi-generational households living in the same house. We have to be able to provide isolation facilities not only for travelers coming in, but for people within the same household. That if you test positive, you are able to identify who are the members of those households who are at higher risk for worsened clinical outcomes, and that may need closer monitoring. How are we able to isolate those people? They can't afford hotels. One of the things I propose is that, in our genetic makeup as Guamanians, is that we are always ready. Of all the jurisdictions in the United States, in our DNA is disaster preparedness and response. We have been through many typhoons and many natural disasters. I believe that this is one aspect of our community that we can capitalize on. We need to be able to convert some of our schools, like what we do in typhoons, to isolation facilities for people within our community. We cannot accommodate everyone in a hotel. We cannot simply afford it. So we are right now paying fixed costs in terms of the schools, in terms of power, water. We're not turning off any of those things. We have rooms in place. What we just need is to be able to allow people within those, once we have contact traced them in their household, are you able to social distance at home? If not, they transfer members of that family to an isolation facility, giving them the option to do that at the government's expense, which I think will be a cheaper option than renting out hotels. So we have to think long-term in terms of this. Eventually our CARES money will run out and we have to make efficient use of it. The coronavirus pandemic is not a sprint, but rather it is a marathon in which we have to prepare for this in the long run. In terms of we are at the mercy of trying to get a successful vaccine, not only created, but distributed and reaching our shores and being able to vaccinate everyone in a time frame that will probably take a year and a half. Now, one of the things we talk about is this contact tracing infrastructure. This is one area in which I think public health needs help on. It needs a lot of help in terms of being able to have enough boots on the ground. Now, in public administration, there's this new paradigm of not government, but governance, in that the problems, because of globalization, have become larger than even the state, local, and national governments are able to do. What you need to be able to pull in is nonprofits, right? The private sector. We need a better collaboration in terms of getting all these contact infrastructure in place. One of the proposals that I would advocate is to be able to hire these contact tracers get nonprofits who are struggling, get business who are struggling, using some of those federal monies to retrain these people for contact tracing. We need to have more of them in order to be able to not only efficiently but quickly identify people who are infected and people at risk of exposure and isolate them in order to reduce the risk of transmission. Now, the third piece is I'm glad that we have an app in place, but let's make that app better in terms of linkage of technology. We need to be able to have a way in which people receive messages, how we receive instantaneous updates that, you know, when we reopen up again, we allow people to go out to different activities, that ideally there should be a message sent if a positive test result is resulted basically from a lab, sends out a mass message to everyone who was at that facility at that time to self-quarantine. This will prevent us from having to go into massive lockdown. Therefore, if it says that I may have been exposed to the virus by going to X and YZ restaurant on September 12th, that, here are the instructions clear that you self-isolate, someone will contact you within 24 hours, and to risk stratify and possibly remove members of that household. That's how we should be able to do it. And to also recognize that there has to be an individualized approach to reopening. Our experiences in Guam is very different from somewhere in Tampa Bay, Florida, or anywhere else. We have a different cultural mix. We have a different way of life here. And we can't just apply a cookie cutter approach to reopening. We have to tailor it to our community. What is our strength, weaknesses, opportunities, and threats, right? Like what I said, we have a lot of multi-generational households. Being able to social distance those people within the same household will be a challenge. Now, hospital capacity. How are we able to build hospital capacity? One of the things that I was very grateful for when I came back on island is our ability to actually have a COVID hospital, which I think is brilliant. It limits the spread and the activity to just that one hospital. If we continue to keep it that way, as well as opening up the skilled nursing facility to be a COVID facility, it would actually benefit our community greatly. Now, in terms of the next one is data-driven policies. Our policies have to make sense. We cannot expect people to abide by them if they don't make sense. And partly, one of them is having people in a beach, you exercising alone does not make sense. That does not contribute to the spread of the virus, versus you going into a crowded bar does. So being able to risk stratify and make policies based on that, I think it'll be easier for people to basically comply with these orders if they make sense. The last one is our public health infrastructure. The best time to prepare for another pandemic is now. Members of the Guam legislature and their staff have to start preparing. What is our public health infrastructure? What laws do we have on place on the books right now? Reviewing the GCE, the Guam Code Annotated, and be able to make proposals for having a public health, legal, regulatory infrastructure in place so that if and when we do have a virus outbreak again, that we're able to respond to it. Not waiting until it happens, but taking the experience of South Korea. They have prepared 17 years for it. Our time for preparation for this virus and the next outbreak should be now. Now, I just want to leave you guys with a quote, in that Thomas Jefferson once said, "There is nothing more unequal than the equal treatment of unequal people." The effect of this virus in our community is not equal. And therefore, our strategy should be one in which we direct resources that we have in order to help our community, members of our community who may not be able to social distance, our homeless population, which are at great risk for worse clinical outcomes, but more importantly, their ability to spread the virus to the community. We need to be able to be our brother's keeper during this time and to address and utilize our resources, our federal resources, to get the most bang for our buck in terms of what strategies can help us not only mitigate the virus, but look at us going forward as a community. How can we be better? Dr. Maya Angelou once said, "If you think better, you will do better." And I think as a community, we can do better. And these are some of the resources that I used to prepare the slide, and if anyone's interested in them, I would recommend that you read some of the examples